आज के कार्यक्रम में हमारे साथ उपस्थित हमारे हेल्थ के स्टेट मिनिस्टर मैडम अनुप्रिया पटेल जी, कंट्री डायरेक्टर WHO हैंक बेकेडम जी, DGHS श्री जगदीश प्रसाद जी, एडिशनल सेक्रेटरी श्री अरुण कुमार पांडा जी, हमारे डायरेक्टर द सेक्रेटरी हेल्थ रिसर्च and Director General ICMR, Dr. Soumya Swaminathan ji, Dr. Gangadhar, the Director NIMHANS, Love Agarwal, Joint Secretary, यहाँ उपस्थित सभी हेल्थ सेक्टर को रिप्रेजेंट करने वाले ऐसे महानुभाव, डेवलपमेंट पार्टनर्स, मीडिया के रिप्रेजेंटेटिव्स, इलेक्ट्रॉनिक मीडिया और प्रिंट मीडिया, और हमारे 40 सेंटर्स में से इस कार्यक्रम में शामिल होने वाले ऐसे हमारे सभी महानुभाव, ये आज बहुत ही खुशी का दिन है कि हम 69th बर्थडे ऑफ WHO मना रहे हैं। मैं अपनी ओर से और आप सब की ओर से इस दिन के लिए हार्दिक शुभकामनाएं देता हूं। एक लंबी यात्रा, वी हैव कम अ लॉन्ग वे, 194 countries joining hands with WHO, and under the leadership or the stewardship of WHO, we have been able to address the health issues in the right perspective, sharing our experiences, and in these 69 years, we have been able to address all challenges related to health. In the last century, we were facing issues related to communicable diseases. And in the end of the century and the starting of the new century, we started addressing the issues related to NCDs. And a strategy has been developed to go for a comprehensive health strategy, so that we are able to address all issues related to health. Last year, 3 years back, we have been able to address the issue related to Ebola successfully. We have been able to see to it that Zika virus is contained. We have been able to see to it, our surveillance system has been able to see to it that how do we address the new strains which we face in day-to-day life and try to give an answer to it and address it. So practically all issues have been taken care with the support of WHO, and all countries are responding to it. So when on 7th of April we celebrate the World Health Organization Day, it is indeed a matter of great happiness to look back for 69 years, how we have come forward and how do we plan to go forward. This is the day when we have to think in these terms. I am happy to share that India is also maintaining the pace and trying to see and address the issues accordingly. You will be happy to note when we are celebrating the 69th birthday or the World Health Day, in the last 1 month, we have done many new things, many new initiatives have taken place. We have come out with the 2017 National Health Policy, which is progressive in nature, accepted by all, appreciated by all, with a very long consultation of all sections of the society and stakeholders. It is a holistic approach which we have developed. We have tried to see to it that medicines become, the focus has been from rog se nirog ki or. The focus is that we should not think in terms of addressing the issue of disease. We should address the issue that how we can be disease-free. So, rog se nirog ki or. The focus has been for a holistic approach, pluralism. So, cross-consultation between pathies, sharing of the institutions, references, cross-references, that has also been made a part of our national health policy. We have been talking about universal and comprehensive health strategy. When we talk about comprehensive and universal health strategy, it means that we will have geriatric, we will address the issue of geriatric, palliative, rehabilitative. All issues will be addressed. We are trying to be universal, and for universal, you will be happy to note that India has decided that we will have early screening, and 100 districts have been selected. Training is going on. In the month of April, we are going to launch universal health screening, which means hypertension, diabetes, cervix cancer, breast cancer, oral cancer. We will have universal screening. We have developed a program which is called Early Detection of Delays, Deficiencies, 4Ds. And that too also we are trying to see to it that we go forward in that direction. Today we have launched an application where we are going to have that DVD dashboard. We have launched the program which is called as Free Drugs and Diagnostic Facility. In this new health policy, we will engage the private sector also to fill the gaps, but see to it that primary health center works accordingly and we are able to give them drugs and diagnostic facility. Over more than 1 lakh sub-centers are going to be transformed into wellness centers. Some 2,500 sub-centers have been selected and the training is going on. So we are expanding the scope and making it more comprehensive. The same way when we are talking about depression and when we are talking about let's talk about depression, I am happy to share with you that the Lok Sabha and the Rajya Sabha has passed the historical Mental Health Bill 2017. Which is also very progressive in nature. It is patient-centric, it is path-breaking. Many of you might not know that now treatment of a mental disorder person has become his right and it is the duty of the state to give him that facility. We have tried to add the element of humane in the whole program so that it is the right of the patient to see that he is treated best. The provision of nomination of the representative, the provision of advance directive, the provision of recognizing the caretakers, all these are very unique provisions, and especially decriminalization of suicide. This is a very historical. We have started in 1912 with the Lunatic Act. And in 1987, we came out with the Indian Mental Health Care Act. And now, in 2017, when we come out, it is a very progressive bill which has come. So what I would like to say that yes, we are trying to work on the guidelines and see to it that whatever best we can give in the mental area of mental health is also there, which we are taking care. In the lighter vein, Mr. Arun Pandaji was talking that all his points have been spoken by Henk Bekkedem. You know, the difficulty of a key speaker or keynote address is that I speak the last. And at that point of time, all the points have been spoken. So I have to face two difficulties. Number one, the concentration level is also on the minimum side. And number two, all the points have been exhausted. But still, many people have talked about mental health care. And many suggestions have come. I accept all those suggestions. I don't know whether I should share from this forum about my private observations about mental health care. But yes, the more we have become like machines, the more problem we are creating. Honorable Prime Minister has talked that we should express, not suppress. He has talked about, the theme is let's talk. I think that we have to talk in two senses. Number one, we have to talk about the disease. Number two, we have to talk among ourselves with our family members. Life has changed completely. We are under the same roof, but we are more friendly to our appliances than to the human being. Hours together, we are very happy with the television and the remote in our hand. And hours together, we are very happy with our mobile. Not talking to each other. So हम लोग हम से मैं की ओर आ गए हैं. And we have become loners. And when we become loners, it has got its own impact. So हमारी कोशिश होनी चाहिए कि हम की ओर चलें. We should not be loners. इसलिए lifestyle is also one of the very basic reason which has led to this depression. And everybody at some stage or the other faces depression. The degree may be different, the shade may be different. I'm not a doctor, so I can't talk about what chemical imbalances take place and what should be done. But yes, हम कहते थे, man is a social animal. Now there is a question whether we are social or not. We are so self-centric. Appliance और हम, यही हमारी दुनिया हो गई है. इससे बाहर हम हैं नहीं. And we consider ourselves to be independent. So you face the burden also independently. And you face the wrath also independently. If you share, you express, it is a healer, which everybody has talked about it. It means that we should develop the lifestyle issues also, it needs to be addressed. I've seen people in last century, and even our forefathers, when we hear their stories, their capacity to fight back was immense. Slowly the fight back capacity is decreasing. We have become too sensitive. Our resistance is minimizing. All these issues need to be addressed. So it's not only a mental issue, it is also a social issue, it's also an issue which needs to be addressed. But when I stand here as a health minister, you may ask me that yes, whether we are going to celebrate April 7th as one day for the mental depression, or we are going to take it as a program. We discussed this matter with the ministry and with the NIMHANS, and we have come out some strategies which I would like to share with you. Number one strategy is that we will try to integrate Ayush and yoga in our mental health program so that we are able to see to it that how do we integrate and see to it that this can help. Number two is integrating the mental health with the PHC. At the PHC level, we will be integrating it. Number three is extensive training at primary and secondary level to the ANMs and ASHA workers at the sub-center level, so that we see to it that how they can also help in the community. They become our communicators and translators and transformers at the PHC level. More engagement with NGOs, community-based organizations, and try to address the issue of stigma also. We will also go forward under the NHM program for capacity building of the states. We will strengthen the mental health institutions in like NIMHANS and other institutions also, and we will also see to it that the departments in the government medical colleges are also supported in that direction. And we will also strive and see to it that the mental health policy 2017 is implemented in letter and spirit. This is the commitment which we take today. And I feel that if we go forward in this direction, we will be really trying to see and translate in India the theme of World Health Organization Day, the World Health Day, that is Depression, Let's Talk. I am trying to be practical and trying to see to it. My ministry and my officers have been very proactive in this direction. I congratulate them. I thank NIMHANS for doing a wonderful job. They have done a really good job, and that needs to be now replicated in other parts of the country. I have asked NIMHANS to become the mentor in that direction and to see that other institutions also work in that, with that very spirit and with that very quality. They are working on it. They will be coming out with the program. So once again, I wish all of you to lead a very healthy life and dedicate yourself for the health, and also see to it that we make India a stronger India, a healthy India, and India which responds to all types of challenges related to health. Thank you very much.